everyone, welcome to another Vet Talks with Dr. Brian McLaughlin, and we have a special guest with us. This is Bentley. Bentley, look at the camera, it's your big moment. He's here to just say hello and help us kick off our next session, which will be all about pet wellness tips. So Brian, want to get us started? Oh.
Yeah. Hey, Bentley. Bentley's 6 months old. He's an office companion to our staff here in the office. Welcome everybody today. We're glad to have you on, and hopefully we can answer some questions. Feel free to submit questions throughout the time that we're on Facebook here, and we'll try to do our best to get them answered. If not, we can answer them afterwards. It's not a big deal. We'll try to get to as many questions as possible. We had a lot of questions submitted ahead of time, so it's something we'll get to if we don't get to them on this Facebook Live event.
And just a reminder, everybody that submits a question either before the event, during the event, or directly after will be entered to win a prize pack worth $50 of VETalk products. So make sure you get your question in, and if we don't get to it here in the live broadcast, we will submit an answer as soon as possible within the next 24 hours. Okay, so let's get started. So we had a couple of questions come in before the broadcast, so let's get to a couple of those while we're waiting for everything to kick in. So Becky was asking, so she has a 2-year-old lab mix, and she says when she has to pee right now. I think we've all probably had a pet that has had to pee right now.
Or myself.
Yeah, exactly. We've all experienced this in some form or fashion. But she lives in an upstairs apartment, and she says she may go right in front of the door while she's getting her shoes on or a few minutes away in the walkway. So she asked, do you think this is just the way she is, or is this a problem with potty training? And she does say that she is a rescue.
Okay. So the question really is, is going to the bathroom having to go right away an issue? And it certainly could be. I feel that I would want to know how many times a day she is going outside. If it's only a couple times a day, it may be that she needs more frequent visits to outside. I know living in an apartment, maybe on the second or third floor, maybe a little bit more difficult to do that and to get down there. The first thing I would want to know, though, or have a physical exam done, have a urinalysis done to rule out any problems, whether it be a UTI, stones, or something like that may be causing her to have those urgent issues to go right away. So that would be something that I would do right away. There are treatments for that depending on the cause of it. It may just be that she has to go and she can't hold it. It's something that definitely needs an exam and needs to have a little bit further workup to be able to determine if it maybe it is a behavioral issue. If we rule out everything else, we could go down that road of looking at behavioral issues or a problem like that.
Okay. So, Kathy asks, at what age should I start giving my dogs joint supplements? They are all large dogs, greyhounds.
Oh, great question about joint supplements, and this is probably a matter of opinion, and I'll give you my opinion on it. So I would recommend starting it earlier than later and not waiting till a problem comes about with osteoarthritis or any other joint issue for that matter. And especially in those dogs that are working dogs, sporting dogs, larger breed dogs that are prone to osteoarthritis, I wouldn't just wait for that problem to occur. I would start something ahead of time, and something like Flexit in Advance, which is contains UC2, is a once-a-day product that could help out before things before osteoarthritis even sets in. So it's something that I wouldn't wait, and definitely consult your veterinarian on these things. But my opinion is I wouldn't wait and start them on those breeds that are more prone to osteoarthritis for sure.
Yeah, I have a Wolfhound and a Great Dane at home, and they're both on Flexit in Advance, and I like it because there's no loading. With their size, a lot of times I'd have to give them, quite a few pieces a day in order for it to work, and so with that, it's just the one. And with a toddler at home also, and the amount of extra food they're
Yeah.
eating, how I can limit treats is always a plus. So
Yeah, no, it's a good point that you make. There's a lot of products out there, and some of them have loading doses to them. As Emily was saying, with a Flexit in Advance, there is no loading dose. It may take a little bit of time to see results, but we certainly don't have to load them, front end load them, and it is, like we said, a once a day product.
Okay, Barry Sweet is asking on the Facebook page. She says she has an almost 10-year-old lab mix. What is the go-to home remedy for fleas?
Go-to home remedy for fleas. Oh, you may get me on that one. I'm not as familiar with the home remedies for fleas, but I can tell you that there are plenty of commercially available flea products out on the market made by very reputable veterinary pharmaceutical companies, and now more than ever there's many of them, and I think the biggest thing that has come about is they're no longer the standard to apply them topically. There's a lot of oral products out there that are extremely safe that I would recommend over any type of home remedy for fleas. You have to be really diligent about those things and keep them on them monthly, depending on what part of the states you're in. And it's to me it's kind of a no-brainer that way to put our patients on those preventative flea and tick products monthly. Some of them even last longer than that. So there's a lot of technology that's been done in that area, and I think you're fairly safe with trying a veterinary pharmaceutical product.
Yeah, I know in Texas, because it stays warm so long throughout the year, I keep my dogs on flea medicine the whole year. I know sometimes regionally, I don't know if there's a difference there, if it's best to just keep them on something yearly.
It really depends what part of the country you're in. If I do keep my dog, a golden retriever, who will be 6 early December, and I keep him on flea and tick preventative year round. And I live in a cold environment where fleas aren't typically found in the U.S. or not as common. Ticks definitely. So bring up a good point. It really depends on the part of the U.S. that you're in for flea and tick prevention. Some areas are way worse, like for instance the Southeast. So Florida, hotbed for fleas. Ticks, on the other hand, maybe the Northeast, out west, so the mountainous areas, but there still are ticks here in Texas and in the Midwest as well. So it really depends, and definitely consult your veterinarian on what they recommend to be completely safe year round, for sure.
Okay, we're talking about pet wellness tips today. So if you have a second to type in a question, we are doing a giveaway. So make sure you get your questions typed into the comment box, and we'll get to them. But I do have a couple of other questions that came in yesterday. One person asked, I have a 2-year-old Shih Tzu Yorkie, and she cannot make it through the night without having an accident in the house. She says she takes her outside before we go to sleep, but I guess it's still happening. Kind of related, I guess, to the first question. So again, this is a issue, maybe a little bit more of an incontinence issue with this dog, female dog, right? Female dog. Yeah. And I would want to rule out anything that could cause incontinence, especially in an older dog. A lot of times it is a urinary tract infection. It could be that they have stones, possibly. Could be an anatomy problem with the makeup of the bladder, the ureters, which come from the kidneys. There could be some issues there. Could be that the sphincter that closes the bladder, that prevents urine from just leaking out, is becoming faulty. So there's a lot of things that I could think of right off the top of my head. So it would certainly be great to have a urinalysis done, a full physical exam on her, and make sure that there is not something that's glaringly going on. There are medications for sphincter tone or urethral sphincter tone if they are leaking, that can be very useful and are very useful for that, and would prevent that from happening depending on the cause of it. So certainly start with a urinalysis on that. And dogs, and I didn't mention this on the first one, but dogs really have an uncanny ability to hold their urine. We don't like to do that, but they do have a great ability to hold it. It's not very healthy for them, just like it is for us, but I feel like that ability for them is way greater than what it is in humans to be able to hold urine. But we still need to be taking them out on a frequent basis and giving them adequate potty breaks. Okay. So Lorna asked this question, and I think it's great because I think a lot of pet owners struggle with this, but how do I know if my pet has a food allergy?
Great question about food allergies. Again, areas of the U.S. when we talk about seasonal allergies or just allergies in general, it's really going to depend on where you are and what your dog's allergic to. Food allergies, on the other hand, really the only way you're going to know is to do an elimination diet. And basically what that is you're going to remove everything they've been eating, so treats, their diet that they're currently on, and put them on a novel protein diet. There's a ton of novel protein diets out there. I think someone had mentioned alligator out there at some point, or I think there's been some kangaroo, yak. So those are all proteins that aren't too common in your standard dog food. So you're going to switch them to that diet, and you're going to leave them on that diet for a long period of time, really 4 to 8 weeks. And then once that's through, continue with that diet, and you can start adding in certain things to see if they react to it. But that's the true elimination diet. It takes a lot of patience, takes a lot of want by an owner to do that, because it's really hard not to give them treats all the time and to really figure out that food allergy. There is allergy testing for that. If the diet they're on has chicken or beef or some common protein, that may be the culprit. It may be wheat, it may be corn. So you really have to eliminate all those common things out of there, put them on a novel protein diet, and see how they do. If they improve, again, you can start adding in things just like we would with humans. My daughter is actually going through some of that right now because they're having some issues with similar things, not necessarily just skin issues, but more headaches and things like that. So we're trying to do that same thing, which is extremely difficult. I'll just tell you that.
Yeah, I'm sure. I had a little taste of it when my new baby was born. It was really difficult. Thankfully, she does not have an allergy.
That's good. That's very good. Very good.
Okay, Kim asks, what are your thoughts on laser treatments for dogs with hip issues?
Yeah, laser treatments have become a very common modality for veterinary clinics, probably over the past 5 years or even more. And I'm not going to get into the detail of what lasers are, but I do think it is a benefit for any type of injury, joint injury, post-surgery, things like that. It can't hurt, and if done correctly, there's really no drawback or side effect to it. It can prevent, if we're talking osteoarthritis or arthritis in pets, it can prevent maybe jumping to a drug that may have some side effects. We may not have to go to those things right away. So it's something that I'm in favor of, and it's certainly becoming more of a modality in veterinary clinics.
Okay, that's exciting. Joanne asks, is there anything to help a golden with allergies? One vet said it's genetic, and the other one is just prescribing and giving her pills. Mm-hmm. So I know we just hit on allergies a little bit, but I think maybe more the question is more around, when you're getting different advice around how to handle the allergies, mm-hmm. what's the best, how do you know what to do?
Yeah. We kind of touched on it on the earlier question with the food allergies, and I think it's really important to talk with your veterinarian and not try to diagnose it on your own as to, is it a seasonal allergy, is it a food allergy, is it something that it's in the environment. We really need to figure that out. So we would want to know that right ahead of time. If it's a seasonal allergy and we can deal with it by giving medication during that seasonal time, then we may be able to deal with that. There is merit with some genetic statements there. Certainly allergies can be genetic. It doesn't really help you with the treatment of it or finding out the cause. So there are ways to find out what they're allergic to. There is allergy testing. If we just want to treat the symptoms, there are medications for that too, but you're never really going to find out what is causing that allergy. Yeah. So it really depends on how severe they are, what time of year, is it a seasonal allergy, is it a food allergy, and figuring that out first before we jump to other things or not even figuring out what's causing it. So
yeah. I have to laugh at this next question because I can only imagine that every pet parent, dog parent has struggled with this, but Julie asks, I have a 9-month-old rescue puppy. We got her at weeks old. All of a sudden, she has a digging problem. It's funny. She said, I think we have moles, but then I found out it's just the dog.
Yeah. This is something fairly common thing for dogs, I should say, with digging, and it can be caused typically, not caused, but some causes of it would be that they're trying to stay warm. So depending on what environment, or cool, excuse me, they're trying to stay cool. So depending on the environment, maybe it's warm. If they dig down into the ground, they can lay in a hole. It's going to be cooler down there. Certainly, if they have if they have a treat that they eat a little bit of and they're going to go hide it away for later, that is certainly a cause of digging as well. Other causes would be what you're mentioning here, which is there's some rodent, there's something in the ground. I've had some relatives' animals dig up my yard a few times, and because they were searching for lizards or searching for rabbits or something like that. So moles, definitely. So it is somewhat of a normal behavior for them to do. Where it becomes abnormal is, is there not an animal there? Are they not trying to get cool? And then we have to really look at behavioral issues. So maybe if it has to do with the treat, they're burying a bone that they've partially eaten, and maybe we don't give them those bones. I know that's hard, but maybe we don't give them those things. We may be able to give them something to distract them from that behavior, but if it becomes a major issue, it may be something to definitely consult with your veterinarian if they don't feel comfortable dealing with it, because we maybe have ruled out some of these other things, that we maybe consult a behaviorist with that and see if we can't help out with it. Okay. So, but a very common problem and somewhat annoying, I guess, too.
I'm glad you said that, because now that you mentioned it, it does seem like my dogs dig more in the summer, and it's because they like to lay in that cool dirt. Yeah, even though they have access to the air conditioning.
Yeah. So, and it may be just that you have to change up their environment a little bit, or not allow them have access to the yard when it's 100 degrees outside. Yeah. And they want to lay outside, which is odd, but they do.
Okay, next question. Sarah asks, how often does a dog that is on a monthly preventative have to be rechecked for heartworms?
Very good question. And the American Heartworm Society and the majority of veterinarians are going to recommend yearly testing. And I know that kind of sounds odd. You may have some comments on that or have questions about it, but we have very good preventatives for heartworm disease, but they're not foolproof. They're not always 100%. And if you miss a dose of that and you think it's okay, or maybe you forget for 2 months, that's a window right there for a mosquito to bite, transmit the heartworm, and then we have that cycle all over again. And once they get adults, we're not really killing adults with the preventative. We're killing the actual larvae with that. So that's a whole different other conversation about the life cycle of a heartworm, but yearly is what's recommended. A lot of our preventatives, again, aren't 100%. There's been some concern with some resistance with some of the preventatives, so it's really just to make sure that they don't have a positive, which it could happen if there is some resistance there, or we're missing doses. So it's just to make sure. And even I'll tell you that just for my own personal use of heartworm prevention, I do test my dog yearly. I know he gets it on the first of every month. I still test him just for that simple fact of there could have been something that was off. There could be some resistance going on, which isn't very common, but it has been seen. So yearly, to answer your question.
Yeah, that makes sense. Okay, this question is from Ellen, and it's specific to Flexit, which we were just talking about. It asks, can it be given to micro dogs that are just about 2.5 pounds?
I want to know what that breed is. It's 2.5 pounds. But, yes, it's perfectly fine to give Flexit Advanced to dogs that are 2.5 pounds. It is a once-a-day product, and because of the way that the product works, the UC2 in it, we don't have to dose them off of their weight. So a 2.5 pound dog compared to a 100-pound dog, or your dogs, for instance, they're still going to get one chew a day. So great question. You can still give that once a day to a 2.5 pound dog, and we shouldn't see any problems with it.
Okay. Yeah. How often, I don't have a name with this question, but they're asking, how often would you recommend bathing my dog? And are there any products that you would recommend that could help with the dry skin?
Yeah, so I think we had a question about cats in one of our previous Facebook Lives, and cats probably less frequently than dogs. And I think, again, this is a matter of opinion on this, and really how dirty or how stinky does your dog get. Yeah. So I would say commonly maybe for most people would be every 2 to 3 months, but it really depends. Is your dog outside? Is your dog inside? Does your dog not go outside and get dirty? For my dog, who goes and rolls in the grass and may roll in some poop or stool, which happens occasionally, I may be giving him a more frequent bath. The issue with that is if we do give frequent baths, we could dry out their skin, and really depending on the environment where I live, it is a dry environment, so I don't want to dry out their skin. And so I would use something with a moisturizer in it, aloe, something like that. We do have a product called aloe and oatmeal shampoo and aloe and oatmeal conditioner, which has properties in it to help with mild itching, very, very good with dry skin as well. So that's something that I would feel comfortable if you're doing it every 2 weeks, to give a bath every 2 weeks with that product and not have a problem with drying out the skin. And again, it really depends on how dirty your dog gets and how stinky your dog gets and what you like in your home. So yeah.
Dry grass season is the most annoying time of year for me, because my wolfhound will go outside and just lay in it and roll and come inside and just tufts of grass everywhere. It just drives me crazy.
The other thing with that too, and I didn't mention it, is it's compliance too. Not that we're asking someone to bathe their dog, but how often do you want to bathe your dog? Is it an enjoyable experience for you? Is it an enjoyable experience for your dog? Do you take them to a groomer? There's people that get their dogs groomed fairly frequently, once a month, maybe even every 2 to 3 weeks. So it really depends on what you want with your dog, and there's really no right or wrong answer. But if we overbathe, we could cause some issues with the skin.
Yeah. Okay. Let's do I think we have time for 2, maybe 3 more questions.
All right.
This is a cat question, so I think this is a good one. We haven't talked too much about cats yet, but my cat has recently had trouble climbing our stairs at home. Are there any tasty supplements you would recommend to help his joints?
Mm-hmm. Yeah, so cat... and I was just having this conversation with one of our regional managers before I got here today, before this event, about her cat and having problems jumping up on the couch, stairs and whatnot. And she did take her cat in, and definitely there is some arthritis in the knees, in the back. So that would be the first thing to really determine, is it actually, arthritis or some issue? We don't want it to be a medical issue where they're more lethargic, they just don't have the energy to jump up. So we want to make sure that that's what it is. When we determine that it is arthritis, there are definitely some options for cats, definitely less option for cats than dogs. Glucosamine chondroitin is a common thing, omega-3 fatty acids. There are products out there that contain all of those. One, for instance, is Flexit Plus, which is a product of ours that contains glucosamine chondroitin, along with some omega-3s, some greenlet mussel as well, which has some anti-inflammatory type properties to it, but a nutraceutical product, so very minimal side effects. We do have a cat formula for that is really easy to give. I mean, it's really a half a chew once a day and easy to give, so that is an option. Past that, there are some things that we could add in. There's not too many non-steroidals for cats, but there are some out there that are for short-term use. But really in cats, it's a somewhat of an issue in veterinary medicine that there's not a lot of products out there. In addition, we already talked about Flexit Advanced, so you can use that in cats as well, which is once a day, which may be a lot easier for a cat.
Okay. Do you think, just as a side note to that question, do you think sometimes the weather, it getting colder, does that have an effect there?
Yeah.
I know with my dog, she's older, and it seems like since it started getting colder that it's a little harder for her to get up.
Yeah, just like humans, as we age, which I've noticed this as I've aged, it takes a lot longer for me to warm up and to be agile and nimble, meaning that I have a story where I went to jump at a bounce house not a bounce house, but a trampoline place with my kids, did not stretch out, just went at it, and I'm sure I tore something in my calf at one point, and I just attribute that to not warming up. So the same thing with the cold weather. It's colder. It takes a little bit longer for them to warm up, to get moving and whatnot. Similar thing with humans and dogs and cats. So there is some merit to that. I would just say don't just, if you're going out to run in the morning, don't just start on the run. Maybe start off with a walk, get them warmed up a little bit, loosened up a little bit, and then start going.
Okay, that makes sense. I think we're right at about time. I know there were a couple of questions that we weren't quite able to get to, so we'll make sure that we answer those in the comments so that you can get an answer from Dr. Brian. Once again, don't forget to ask a question if you want to be entered in to win $50 of VETaChenol products. Anything else?
Just want to say it's getting close to Thanksgiving. We all have a lot to be thankful for, so I want to say happy Thanksgiving to everyone. We probably won't have another Facebook Live before Thanksgiving, but we'll let you know for December. Holidays are coming up, so a lot of stuff to talk about with that as well. So looking forward to that, and everyone, again, have a happy Thanksgiving.